Evidence clearly supports weight loss as an effective strategy for managing knee osteoarthritis in overweight and obese individuals. Weight management is universally recommended as a first-line treatment by all major international clinical guidelines. For every 1 pound of weight lost, the knee joint experiences a 4-pound reduction in load. Additionally, a 10% reduction in weight has been shown to improve pain, function, and quality of life, while also reducing joint load and inflammation. But is any weight loss diet sufficient for managing knee osteoarthritis? Or do some diets work better than others? Unfortunately, clinical guidelines often provide little detail on this. That's why today we'll dive into the research to explore which dietary strategies may be the most effective in addressing this issue. But first, as always, please take note of our disclaimer. When managing knee OA in overweight or obese individuals, 3 diets often come up: the Mediterranean diet, the DASH diet, and the Anti-Inflammatory diet. While they have different focuses, they share many similarities. Take their macronutrient breakdowns for example. Also, all 3 emphasize whole, minimally processed foods like fruits, vegetables, whole grains, and lean proteins. They also prioritize healthy fats from sources like olive oil, nuts, seeds, and fatty fish, which are rich in omega-3s to reduce inflammation. The main differences are in their focus areas. The Mediterranean diet promotes heart health with extra healthy fats. The DASH diet was designed to lower blood pressure by reducing sodium in part, and the anti-inflammatory diet targets inflammation. But all 3 diets focus on nutrient-dense foods, which can help improve knee OA symptoms. Messier in 2010 suggests that for overweight or obese adults with knee OA, caloric restriction combined with a balanced macronutrient distribution encompassing between 15 and 20% protein, less than 30% fat, and between 45 and 60% carbs should be the focus of any dietary intervention. Since all 3 diets fit within these ranges, any of them can be effective for weight loss and improving knee osteoarthritis symptoms. However, what does the research say about which diet is best for most people? But just on a quick side note, if you're interested in undertaking our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. The Mediterranean diet emerges as a top choice for most overweight or obese individuals seeking to improve OA symptoms through diet. 4 meta-analyses, including up to 16 studies, showed that the Mediterranean diet resulted in greater reduction in body weight and BMI compared to other diets. Additionally, a 2023 umbrella review by Book et al. Analysed study across all BMI ranges and found the Mediterranean diet was the most frequently studied. The majority of evidence from 5 systematic reviews and meta-analysis supported its effectiveness in improving osteoarthritis-related outcomes like pain, stiffness, inflammation, and cartilage health. This research shows that the Mediterranean diet is not only the best diet for weight loss and reducing strain and inflammation on weight-bearing joints, but also the most effective for providing direct benefits to knee OA through anti-inflammatory effects, omega-3s, healthy fats, and antioxidants, which improve joint function and reduce pain. Yet, it's important to note that if you're overweight and seeking relief from knee OA symptoms, physiotherapy is just as crucial as diet. While again, weight loss and anti-inflammatory nutrition through undertaking the Mediterranean diet can significantly help, physiotherapy plays a key role in addressing the physical impairments that contribute to OA symptoms. Physiotherapists are trained to provide targeted therapeutic exercises that focus on mobility restrictions, muscle imbalances, and regional instability, issues that contribute a lot to OA pain and dysfunction. By improving these impairments, physiotherapy not only helps alleviate pain but also enhances movement efficiency and reduces further joint deterioration. This is why clinical guidelines and systematic reviews strongly recommend incorporating physiotherapy into OA management programs. To give you an example of how helpful physiotherapy is for knee OA, one study found that after 3 months of exercise therapy alone, i.e. the exercise component of physiotherapy, knee OA subjects improved their average pain score on a scale from 0 to 10 by 3.25 points. Also, the same study suggests that knee function was improved significantly as well. Anyway, returning to our original question, is the case closed? Should every overweight person with knee OA simply adopt the Mediterranean diet and leave it at that? Well, not necessarily. For instance, individuals with a BMI over 40 may require a more aggressive weight loss strategy to achieve significant improvement. For many of these individuals, severe knee pain may be present even at rest, complicating daily life. Excess weight itself can be a major barrier to physiotherapy, which, as we've spoken about, is a critical component in managing knee OA. Fat accumulation around the abdomen, thighs, and legs physically restricts joint mobility, limiting the range of motion in the hips and knees in particular. This makes it more challenging to perform essential exercises, hindering efforts to activate muscles that are needed to address OA-related impairments. Given these challenges, individuals with severe obesity may benefit from a medically supervised very low-calorie diet, which can help accelerate weight loss, enhancing the effectiveness of physiotherapy for pain relief and improve joint function. One study suggests that at 3 months, weight loss from a very low-calorie diet can be 3 times faster than the Mediterranean diet. Of course, some of this will be due to the people on the very low-calorie diet having less water retention due to the carbohydrate restriction on the diet. But still, a considerable amount will come from direct fat loss due to the heightened calorie restriction. A very low-calorie diet is exactly what the name suggests, a diet with very low calories, typically between 800 and 1,200 calories daily. Now, when you hear that level of calories, you'd be right to raise an eyebrow, given that at least 1,200 calories are recommended daily for women and 1,500 calories per day for men to intake enough micronutrients to support overall health. However, because very low-calorie diets often use fortified foods with high vitamin and mineral content, this is said to address potential nutrient deficiencies. As a result, a very low-calorie diet is considered a suitable short-term option when medically supervised to improve knee osteoarthritis as well as other specific health conditions for certain obese populations. However, there are specific subpopulations who should avoid this diet. This highlights why it's crucial to consult with a healthcare provider before considering a very low-calorie diet. Another group that could benefit from a very low-calorie diet is individuals with end-stage osteoarthritis, who are at a significant higher risk of requiring a total knee replacement. One study suggests that people at this stage had a 31% increased probability of advancing to surgery within 12 months compared to 3% in people who were at a lesser stage. Also, due to the increased surgical risks and poorer outcomes for patients with high BMI, many doctors require weight loss before proceeding with surgery. Therefore, for these individuals, a medically supervised very low-calorie diet may be more effective than the Mediterranean diet because it accelerates weight loss, leading to improved pain relief, better function, and potentially reducing the need for surgery or allowing the surgery to proceed with better outcomes. In conclusion, for most overweight individuals with knee OA, research shows that the Mediterranean diet is the most effective dietary approach for managing the condition. However, individuals with advanced obesity and OA may benefit from a short-term intensive weight loss strategy to optimize pain relief, improve knee function, and potentially reduce the need for surgery or allowing the surgery to proceed with better outcomes. After reaching weight loss goals, they can then gradually transition from the very low-calorie diet to the Mediterranean diet for long-term management. But again, it's important to remember that this decision should be made in collaboration with your doctor. Have you tried a Mediterranean or a medically supervised very low-calorie diet to improve knee osteoarthritis? What was your experience? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.